Identify signs and symptoms of cystitis and pyelonephritis. Let's take a look at some key definitions. When you get a urine sample from a patient, for most individuals there will be no bacteria in the urine. The urine is supposed to be sterile, especially in men, and we call this sterile urine. Now, if you find bacteria in the urine sample, this could be due to contamination of the sample. This could be from the skin of the patient or from the environment. Once you rule out contamination, if there are bacteria in the urine, we call this bacteriuria. This means the presence of bacteria in the urine. If a patient with bacteriuria has no symptoms, we call this asymptomatic bacteriuria. This is not a urinary infection and does not need to be treated in most patients. If the patient does have symptoms, however, we call this symptomatic bacteriuria, or more commonly known as urinary tract infections. What exactly are these symptoms? The four most common symptoms are frequency, so the patient has to urinate small amounts frequently, and it will be painful, which we call dysuria. There will also be urgency, or the urge to void immediately, and there can also be hematuria, or the presence of blood in the urine. As I mentioned earlier, there are different types of UTIs. The most common one is cystitis, or the infection of the bladder. There is also pyelonephritis, which is not as common but is very important. Symptoms that are more specific to pyelonephritis include fever, which is not always present, but if it is suggestive of pyelonephritis. There will also be CVA tenderness or flank pain. CVA tenderness is detected during physical exam, typically by a physician as they tap on the back of the kidneys with their fingers. UTIs can also be considered uncomplicated or complicated. For example, there's uncomplicated cystitis or there is complicated cystitis. Let's take a closer look.
So uncomplicated UTI refers to infection in a structurally and neurologically normal urinary tract. And this is important because if you have a normal urinary tract, both anatomically and neurologically, that means you have normal flow of the urine, which typically clears the tract. So there's no, even if there are occasionally bacteria, the urine flow will actually wash them out. We also have we don't have guidelines for complicated UTI, but here's the generally accepted definition for it. It's basically a UTI in the presence of factors that predispose patients to persistent or relapsing infection. So these include if the patient has foreign bodies. Most important one is indwelling catheters. Also, if the patient has obstructions, immunosuppression, renal failure, renal transplantation, and urinary retention from neurologic disease. These are, risk factors that basically disrupt the normal flow of the urine, which is supposed to clear the bacteria out and maintain a sterile urine. In addition, infection in men, pregnant women, and children are also considered by most experts complicated UTI. And the reason we try to distinguish complicated UTI is because these infections typically are due to, or I should say, they are more likely to be due to resistant organisms. So having that in mind, it helps selecting antimicrobials when treating complicated UTIs.